Hi everyone, and very good evening to all of you. Hello everyone. Hi, very good evening to all of you. Darshan, Deep, Abhay, Harish, Dr. Jayasee, Subaradi. Very good evening to all of you. Yes, so this is a very important discussion that we'll be having. Hello everyone. Right. I think my audio and video is quite clear, and this is a day, this is an evening that we would like to discuss among ourselves what is the best way out of two things that has come recently today. Number one, Neet PG has been postponed for 4 months, and secondly, Prime Minister Organization PMO Office, Prime Minister Office has given a opportunity to work in the COVID areas and maybe benefit the society. So what we can do out of it. So yes, very good evening to all of you. I welcome you all. Meghna, Shrushta, Amal Roy, Shritesh, Shreya, Shubham, Hima. Very good evening to all of you. Let us be very clear out of today that we don't have any obligations to finish this whole discussion as soon as possible. Secondly, we have nothing to study today because obviously the NEET has been postponed for 4 months. There's no pressure at all. So let's have a small discussion. Let's have a common talk as to what can be done as to the best of your abilities so that this decision that you will be taking has a good effect on your own days and years to come, and maybe will not affect at all your health and your preparation strategies. Yes, very good evening. So Sanjana, Swati, Pavan, Agnivas, Archana, very good evening to all of you. Guys, देखो, before I move forward, let me tell you what are the basic things that have actually come up today. First of all, let me just bring you all to this big notification has come. So the PM has taken key decisions to boost the ability of medical personnel in the fight of COVID-19. I'll first brief you on what exactly he is trying to say, and then let us then decide what we can do out of this, the best of the scenario. The statement first says a very clear thing that yes, you please underline this and not underline, actually please notice this point, that the NEET PG has been postponed, and this has been postponed for at least 4 months. Now this is for sure that NEET will not be held before August 31st. So NEET PG will not be occurring before August 31st. Definitely, if you count from today onwards, and today is just the beginning of May, there's a May, there is June, there is July, and there is August. So definitely there's complete 4 months before the NEET PG will not be there. First big statement. Second, those providing services in the COVID management, now please understand this, will be given priority in the forthcoming, please listen to this word they are trying to say, regular government recruitments. So what does this mean, guys? What does it mean? What do you think does it mean? Does it mean, what do you think? Does it mean NEET PG? Does it mean NEET PG? Does it mean the CMS exam? That is the UPSC exam? What are they trying to tell you? So we should be clear out of it. So what I understand by the government recruitment is not NEET PG. What I understand is the CMS, the Combined Medical Services exam, which could be the UPSC exam, which could be any exam which actually helps you to work in a government service, maybe as a RMO or a CMO, Chief Medical Officer or a Registered Medical Officer. So what my understanding is, they're trying to tell you that you won't be given a brief preferential recruitment in the NEET PG, but yes, they think, or it believes that they would be talking about the CMS exam here. Okay, plus that would be only eligible if you don't work for a fortnight. Please understand, you have to work for a minimum of 100 days of the duty. Now this is a big thing that you must be clear about. Okay, okay. Next, that what we're trying to say is, now this again should be a relief point, that if you are working in a COVID related work, you will be suitably vaccinated. So what does it mean? Suppose you do have not got a vaccination, and suppose you have not got a vaccination and you want to work in a COVID era, you would be given vaccination on suppose day one, and then you would be suitably vaccinated. What does it mean? That means you should be given two vaccines at 28 weeks interval. That means the moment this has come up and you supposedly are wanting to work in that area, you get a vaccine one on suppose day one, and then after 28 days you get a vaccine two. Minimum 28 days, right? Minimum 28 days you get a vaccine two. So unless you are not vaccinated, no one would be actually asking you to work in the COVID era. Do you agree to this or not? So this is another thing that you should be knowing before we start discussion. We start a discussion as to what should you actually do. Please understand that you should be suitably vaccinated. So what I understand from this word suitably vaccinated is that you should be given at least 2 doses of vaccination. If you look about the Covaxin, you should be given it after 4 weeks minimum. And if you talk about the Covishield, it may be 4 weeks, it may be 6 weeks, but I think what I think is the 4 weeks period should be given to you. Okay. Finally, now, this is very, very interesting. Now, I don't know how to put it forward. I don't know whether to put a sarcastic remark or just put it forward. So I'm just putting it to you. Any such professional who sign up for a minimum of 100 days, again, see. So if you are a professional who is signing for a minimum of 100 days of the duty, okay, working for minimum 100 days of duty. So what they want to tell you is, given the Prime Minister's Distinguished COVID National Service Samman for the government of India. Let me not be sarcastic here, but this is one thing that you should be aware of. Okay. So what does it mean, guys? What does it mean? That we actually as a society, please let's be now very, let's now be, let's talk about what should be our duty as a doctor. Let me ask you a few questions, and I want you all to answer it here. Why did you become a doctor? Why did you become a doctor? Did you become a doctor to prepare for PG, or did you become a doctor to serve the humanity? Let me be very clear. So I have not put a question that whether you want to earn money or not, because earning money is the definite goal. Please understand, earning money is definitely a goal. So I'm not asking you that question. My question to you is, why did you become a doctor? Did you become a doctor to actually prepare for PG, or did you become a doctor to serve the humanity? Because I know that earning money is the ultimate goal. Let's not put that question, because the moment I put that question, everyone will have the same answer. Obviously, everyone wants to earn money because our end goal is to earn money. So let me put this question forward. That yes, Swati Rao telling me, yes, our goal, my goal, her goal is to serve the humanity. And believe me, please understand this thing. Unless you don't have that ability, unless you don't have that courage, unless you have that intent to serve the humanity, anything you learn from today onwards is a worth waste of time. That is completely my view. I'm telling you, your views may be different. Your views may be different, but it may, please understand my word. So what are the other thing we should be understanding here? They are telling you that not only, please understand, not only a post MBBS graduate, but any person who wants to serve humanity in any form are actually more than welcome. So they're asking the interns to work. They're asking the final years to work. The final MBBS is also being called to work. And what and how can they work? Because intern can work as a doctor in the medical wards. A final MBBS can be used or to give teleconsultation and monitoring of the mild COVID cases after orientation by their superior, So now we have few points in front of us. Let me just, I have just asked a few questions. Let me see how many have answered it. Swati Rao, Agnivas, Asha, Shubham, Ankita, Meghna, Amal, Harish, and Saranya. So you have answered it that you want to serve the humanity. Now let us come to the every aspect of what you might be going through. One of the aspects that you might be going through is, sir, if we actually start working in a COVID ward, there are a few questions that come to our mind. Number one, what if we get infected? That means you get infected. Okay. First question. Please add any question that you already have. I'm putting my questions to you that actually I have thought upon. Number one question is, what if you get infected? Okay. Second question, sir, is this giving us any advantage in Neet PG? Third, sir, what will happen to our preparation? I was preparing for our Neet PG to occur in the month of January. It is just the month of May. There's no sign of Neet PG. And now they're saying they're putting in the 4 months forward. And I'm in a loss that if I join this, what will happen to my preparation? This is my third question. And fourth question is, sir, is it worth doing this job or not? Is it worth doing this job or not? Okay, there are 4 questions I'm putting forward. Please add that any question that you have, and let me answer this one by one. Number one, the first question I would actually take from your point of view is, So my few things that I should be clearly telling you here is, when I talk about my question number one, that what will happen to my, whether I get infected or not, what will happen to me? Let me make it very clear to you. Dekho, most of the people who get infected with COVID-19 are not the people who are working in the COVID ward with the PPE well worn in them. The people who are getting infected are those who are roaming around in the world without proper mask, or wearing I'll say a cloth mask, or maybe wearing a mask at this level and not at this level. So it is quite proven fact that it is more in the people are getting more infected not due to working in the COVID ward, but basically get infected because they're roaming around without proper masks. So I really don't feel, yes, I really don't feel that that should worry you. But yes, if you have, please understand, my second point is very important. But if you have few people in your home, like your parents, your grandparents, your any big brother or sister who have a small amount of comorbidities, like they have diabetes, they have hypertension, they're obese, right? They have asthmatic tendencies, they have any amount of lung disease, then yes, that is a question you should think forward. That if you have a people, if you have parents working in, or you have grandparents in your home who are there with comorbidities, then this should be a big question mark whether should you join there or not. So what I want to tell you here is, you should not worry about you getting infected, but yes, your one worry that you should have is whether you will infect others or not. This is my first thing I like to put forward here. Okay, that means if you have some grandparents or parents who actually are in their home and whom you feel that you can infect, then I think please think over this and then join it. Okay. Second, the second thing I would like to put as here is, yes, I'll answer all your questions here also. Right. Now, second question is, sir, what will happen to my preparation? I think this is the biggest question that most of the students here are asking me. What will happen to my preparation? Okay. When was your exam scheduled to be? In the month of January. Okay. So you want a breather of 3-4 months, and then the exam was supposed to happen on the 18th of April. Okay. Now, again, you got a breather, and now you're getting 2 months extra, and you had now in the month of May, and suddenly you have now understood that this exam will not happen till the month of 4 more months. What? Now, you understand. Something which you couldn't prepare for 5.5 years, that means 4.5 years of MBS, 1 year of internship, and then 1 year of preparation. That means we cannot prepare for say 6.5 years. We got 6 more months, and now we're getting 4 more months. Do you really think this 4 months will make a difference? This whole 6.5 years, or say 7.5 years, or maybe for some people 8.5 years couldn't do a wonder. Now you are thinking something this 4 months will do a wonder. Guys, it doesn't work that way. It doesn't work that way. Please don't think that this 4 months will give you an extra edge over people who are sitting in their home and working. Yes, but what will happen is when you start working in a COVID ward, what may come to your mind is that I am working here and my colleagues are preparing in their home, so they'll get selected while I am not. Have you seen your seniors who work during the internship? Many of you might have seen this. That what happens in your wards, regular MBBS courses, the people who are actually going to the classes, the people are actually going to the wards, people are actually attending the duties in the internship, those are the ones who get selected, and the people who keep on reading, and they're in their library or their home are the ones who actually don't get a rank. Why? Because the people who are going in the wards, they actually learn something extra than the people who are actually working only in their own setup. So let this not be in front of you. Please understand, let this not be the big question that you should be asking yourself, what will happen to your preparation? Anyhow, let's assume that you are working for minimum 100 days. There are minimum 100 days. Let's assume how will the roster be there? Most of the roster will be either 24 hours duty or 12 hours of duty. A 24-hour duty will be 3 duties per week. Okay, 3 duties per week, and that would be continuing toward that 100 days period. Okay, so I don't really think the question that you should be asking is that what will happen to my preparation. What should you ask? What should you be asking yourself and maybe your family is this worth risking your family members? Because ultimately we all live to serve humanity, and our own family is our own first priority. Okay. Now, the third thing I should asking myself is, what is it trying to give us extra? Is it trying to give you extra in terms of money, or is it trying to give you extra in terms of the uh, NEET eligibility? So please ensure that this is nothing to do with your NEET PG marks. Okay, it may help you in working as a MBBS graduate, working in a CMO or a GDMO. Okay, so it will not, or it may not help you in the NEET PG exam, but yes, it will help you in a NEET PG exam in a way that when you go to the wards, you learn anything extra. You look at the CT scan, you look at the X-ray, you look at the laboratory parameters, you look at a patient, and you start actually learning many extra things. Okay. Secondly, look, just I will say 4 or 5 months, when everything goes very good, you will have that opportunity to actually choose a seat of your choice. Okay, so on what basis will you make a choice? Some of you are interested in medicine, some of you are interested in surgery. So when you work in that ward, you're looking at the PG setup, you're looking at the CCU setup, you're looking at the ICU setup, and maybe you get interested in one of the branches that you will actually maybe follow later on forward. Now, secondly, look, what other problem here is that, sir, I'm not able to concentrate. Actually, when the exams keep on getting postponed, you will not be able actually to keep on studying in the same tempo. So what can you do? So let's assume now you are making a decision not to join this and to continue in your preparation. Let me talk to those people again. I'll come back to again those people who are actually wanting to join. So for anyone who is actually not wanting to join this and keep on continuing with your preparation, let's come back to you. So there are many things that you are actually not well prepared. And let's talk about a topic now. Let's not talk about an MCQ. Let's talk about a topic. For example, let's assume that you have not read in a well way Whipple's disease surgery. So take again belly and love. Read this complete Whipple's surgery, and let's make the topic complete, because now you have that extra time to prepare an extra thing. Okay. So if you are not wanting to join this job and you want to continue preparation, please prepare now by reading a topic from a textbook and then again coming to solve the MCQ, so that those topics which you have not prepared very well can become very strong. What can I do from my side is I can actually start discussing with you various clinical cases. In every week we can take 1 or 2 cases and discuss that from a pathological point of view, and how does a pathology correlate with the medicine and to the surgical point of view. That is what I can help you in that way. Okay. Secondly, please understand one more thing, that what is happening in I'll not compare Delhi to the other cities, but actually what is happening in Delhi is, let us be very clear here. There is a huge crisis of doctors right now in the medical field. Huge crisis, guys, huge crisis. I'm not comparing Delhi to other states, because if you look at a capital city, you have enough number of doctors. But look at your own city. Does your city have enough number of doctors, qualified doctors, who have passed from a government medical college and who have their experience in back of them? They have experience of internship from a good medical college. They have experience of learning things from a good institute and their own medical college. So the people who are actually working now in COVID setup are more or less getting oversaturated. They're getting tired of everything. So when you go into the COVID study, you have that extra zeal. And believe me, guys, if you at all care for the humanity right now, please listen to me and join this, because people right now need you. I've seen people get really dying because of non-availability of oxygen around. Let not they get one more reason to die because of non-availability of doctors. Please, I fold my hands in front of you. If you at all have a small amount of inclination towards your medical field and you want to serve the humanity, please come forward and join this, because this is only a one-time opportunity. Maybe this opportunity will never, I hope this never comes back. But if you see the wards in which you are working right now, the doctors who are employed there, let me not say that wrong to them, but the people who are employed there may not be that much, experienced, because right now the people who are working there are just fresh passed out MBBS, right? You are the people who have worked in MBBS, you have worked in internship, you have maybe worked in for 1 or 2 years in your medical college as a senior resident or junior resident, and now you're trying to prepare for the PG. So if at all, please understand, if at all you want to serve anyone and you want to take and give your inputs into this COVID-19 huge pandemic, please join it. That is my own personal thinking. Please understand, this is my personal thinking. My personal thinking may differ from yours, and if it all differs from yours, there's no worry, it is completely your choice, because ultimately life is yours. Okay, but why did I choose to work in this arise? I am working from in my hospital every day. I have not taken a single leave from the last, from I can tell you, from the last 1 year I have not taken a single leave. Even when there's no COVID, actually I used to take leaves and used to go out and take lectures. But right now I'm not taking a single leave, because I know if I don't go there, the people who work with me or the people who work under me get demotivated. So I feel that there is a need for me to work there, and therefore I daily go there and try to motivate them, try to do my part of job that I should be doing. But please understand that if I was in your situation, that's yes. So what would I have done in your situation? I would have thought about two things. Number one, who stays with my family? Does my grandparents leave? Does my grandparent leave? Does my parent leave? And do they have comorbidities? Yes. I would take a decision that I would not join it. Why? Because I don't want to risk them just because I want to work there. First thing. Second, but if I stay in a hostel and I have that, I don't have people who are actually staying with me and I want to work here. So number one, if I have that courage to work in a COVID ward, I would definitely join it. Now that is my personal feeling, guys. Let me not impose my thoughts on you, but that's my feeling, and therefore I want you to think out of it. And please don't think that a few deviation from your preparation course will completely change your preparation altogether. What did not happen, or what would not have happened in 6.5 years, how will that happen in just 4 months? Tell me just one reason of how will that happen. Okay, but if at all, now again, let's me come back to those people who don't want to join. It's completely your choice, as and you and me should be completely fine with it, because ultimately it's your decision, it's your life. But people who are not joining it, please ensure that you don't waste a single day now. You may take again a 2 or 3 days off because nothing is going to happen for the next 4 months. But any weak topic that you actually have, please start reading it from a textbook and ensure that if a question comes from that topic, you would actually make it right. So yes, let me take your questions now. I'm open to your question. Let me just discuss that. I think I have explained my own bit, but let's now taking your questions. So what about FMG 2021? FMG 2021 will not happen right now, and everything should actually be merged with the Neet PG, which is going to happen maybe after 31st of August. What you would have done in your situation? Sir, I'm not exactly sure that what will have I should have done in your situation, but I told you I would ask myself a few questions, that who stays with me, and then I would make a simple decision based on the facts I told you. What about INICET? I don't think, guys, when look, the country is going through a very bad phase. It brings tears in my eye when I see people not getting a hospital bed, not getting oxygen, the saturation level falling below and going to 70s, 80s, and still not able to get a single bed. Please don't give them one more reason to die. That is only because the paucity of people like us who can actually save their lives. So that thing, no, right now for second year, I don't think this is quite applicable. Not for second year. 100 days of recruitment. However, I want to volunteer, sir, is an option to work for lesser time. The certificate doesn't matter for me. So Navneet Rao, yes, I think when the things actually move forward, because once the Prime Minister office has told about this, now there will be rules and regulations that are set up and will be given to the various states in a matter of just 1 or 2 days. Maybe tomorrow or tomorrow only it will come to your district level or maybe your medical college, and that will be circulated throughout your social medias. And if I get that, I'll share with you as soon as possible. Okay, so I don't think that would be a big thing, but yes, even for a small amount of time, maybe for 50 days or 20 days or 30 days, if you get that, opportunity to serve people, please come forward and help them. Please come forward and help them. I'm having online classes through coaching center, but Bhate coaching center, but in spite of those classes, I would still love to join for the COVID duties. So what I'm supposed to do? So Lohit, what you may do is, see, the best thing that is going on now is there are online classes. That means you can attend the classes from anywhere you want to. Okay. So what you do is, suppose you have a classes going on, so and you're missing them, no worries. You go to the Gurukul app and watch them in recorded form. That is one thing you can do. What about Neet or Next in 2022? Quite a long way to say, but yes, I think that Neet 22 should happen on the right time, because I think the biggest mistake that we did or the government did was not to conduct Neet in the January 2021 when everything was almost normal, guys. I think that was the biggest mistake we or the government did that time. Sir, I'm not vaccinated. So what should I join? No, please don't join if you're not vaccinated. Please understand. Do not risk your life for others. I think this is the thing what you can do. Please don't risk your life for others. Take a vaccination, suitably vaccinated only, then join the COVID duties. Okay? Please be adequately vaccinated only, then join a coaching or then join a COVID-19 duties. Okay? Do not join this. Do not join this. Okay? Do you suggest freshly join to 2K15 batch to join coaching or do jobs, because we haven't attended any PG coaching? Guys, if you're in final year MBS, the only thing you should be able to do now is they do a teleconsultation, and I think that many of you might be doing the same thing sitting in homes. How many calls do you get every day asking for what should they do? The same thing you can do to actually benefit the society. So right now you can work in a form of teleconsultation, and that should be pretty good enough, I'll say, contribution to the society right now. Any views on Neet UG? Guys, I'll not put that thoughts over here. I'll put out in a different phase. I have old folks living with me, sir. I want to work and help people. Will they provide us accommodation? So that depends upon your own medical college or the area that you are actually working. You want to work there. Giving accommodation to everyone is not actually feasible. So I don't think that will be possible. But I'm telling you, if you have some people who are actually in your home and who are basically not suitably vaccinated, or who have some comorbidities, please think before joining the duties. Please don't risk yourself and your family members to do this. Okay. Sir, one help. I would like to join duty, but at last we can get extra 4 months of e-growth. Look, that is not my on my hands. This, please understand this. I'm not talking from the coaching point of view. I'm not talking from any consultation point of view. I'm only talking about from my own point of view, which is that I'm a doctor, and what I am doing, it actually gives me a huge relief. It gives me huge satisfaction, and I'm very happy what I'm doing right now. So if you feel the same, go and join it. Can a single dose of vaccination will work? No, Shubham, single dose of vaccination is not effective unless you are not doubly vaccinated. Do not join that. Okay. Yes, unless you don't get us double vaccination, do not join. Please understand. If you have got a single vaccination, miss the second one, do not join. Please ensure that you and your family members are completely safe. Sir, what if we have tested positive? Now says for 100 days duty after recovery, would I have enough time to restart my preparation for the Neet PG duty? Will it affect my result? I am a post intern. Guys, देखो, if you are already COVID positive, there's nothing to worry about, right? Now, देखो, please do not join this duty for getting that 100 days of certificate, because that may happen, that may not happen. Please understand, I have never said to join this because you'll get something extra. I'm only saying because the country needs you. We are in a very bad shape now. People are dying because of various reasons. Please let us not give them one more reason to die because we are not available for them. That is only why I'm telling you this. Okay. Can you please explain the details of teleconsultation in a separate video? Yes, I'll talk about how to actually give a teleconsultation, because we give a lot of these nowadays. I'll try to tell you that. Okay. In fact, we try to also try to make a separate group, a WhatsApp group, in which we can put the patients can put their numbers and they can contact us and we can give them a teleconsultation. Because do you actually know that nowadays what is happening is people are going for a paid teleconsultation, and the only time they're getting is just a matter of 45 seconds. Are you surprised to hear that? Yes, you should be, but that is true. Just for 45 seconds, they are paying huge amount of money. So if in any way you can serve someone, you can help someone, please come forward and help them. People need you, guys. People really need you. People are dying. And what is life? It's only about birth and death. What is between them? It's only life. People are dying because of something which should not happen. Let's not blame the poor governments right now, because that is not what we can do or what will not help us. But let us not give them one more reason to die. If you've taken one dose, please contact to get how to get the second dose from the area that you've got the first dose, and they will give you a solution. So right now, if you talk about the Delhi, in my own hospital, the vaccination is completely out of stock. Out of stock. And when I asked them, when are you going to give the second vaccination, they said, we don't know. So yes, that is what the state of affairs is. I can tell you, if you're not doubly vaccinated, do not do this. Okay. Will the lack of medical facilities right now in the country, how will us joining for duty help? Beta Ankita, please listen. You are a doctor, and any advice that you give, you actually know how to manage a steroid side effect. You know how to manage any drug side effect. If you're not there, what will happen? Please don't at all discourage your own presence in a COVID ward. Your presence holds a lot of importance. Have you ever talked to a COVID patient? How happy he feels when he's able to talk to a doctor. Have you ever felt that? Talk to someone who is suffering from COVID in your own relative. When you talk to him, it gives someone extra courage to live forward. I was just talking to one of the COVID patient, and I told him, this time will never come. Just enjoy your period of secluded environment, that isolation for 14 days. And he got well. The only message he gave me was, sir, I read few novels and I'm so happy because of that. Thank you. You just give them some extra things to cheer upon. Just talk to them in a good way. They'll will feel better, because ultimately, out of say 100 cases, only 2 or 3 patients need hospitalization, right? My father has just recovered from COVID. Should I join? I have been vaccinated. Any risk for my father? I don't think. If your father just got well, he has no risk, and definitely you are being vaccinated, you should also not have any risk. But yes, if you have other people in your home who are having some comorbidities, think about it before you join it. Think about it. Okay. Viral load for 100 days working in a COVID ward. Yes, that's a difficult question for me to answer. What is a viral load for 100 days? But see, if you are wearing a proper PP quite well, then I don't think there's any reason to worry about it. Now, again, repeat one thing. That if you please make yourself safe before you actually help others. There's a proper saying in the flights. They say, first help yourself, then help others. So unless you don't protect yourself, how will you protect others? So make sure you're vaccinated, number one. You are wearing proper PP. Only then you go for this extra duty that you can do. Okay. How will you join? I think the joining way will actually come forward and be very clearly elucidated in the I think the PMO's maybe letter. And if it comes to me or anywhere, I can see that. I'll share it with you. Okay. Yes, I think the teleconsultation should also be there, and maybe you can help there also. Is it for the 4 months for examination or for notification, sir? Because they will write 1 month earlier. So Neet PG will not occur before 31st August. That means the notification will not come before 31st August. Okay. Neet PG notification will not come before 31st of August. They'll give you 1 month extra. That means you at least have 4.5 months completely. You can record me on this. I will never be wrong now. Neet UG 2020 postponed or not? I'm not think this is the right channel to talk about that. Neet UG has a completely altogether different setup. So that is a different way we can deal with that. Okay. Will there any be incentive in Neet PG? I don't think so. Because Neet PG is a competitive exam. You can't give someone an extra edge just because of some competition, right? So competitive exam will always be competitive exam. But yes, to work in a CMS or CDMO or a GMO or a GDMO, you will definitely be given some extra preference here. I've taken the first dose on February 5th. Second dose has been missed. What can I do, sir? Should I start fresh vaccination? I'm post-intern and I'm already COVID positive before. Guys, if you are COVID positive and 14 days have passed after being negative, you can take the second vaccination. Okay? Unless there is not 14 days, please wait for it. How to apply for teleconsultation? I will share you all the details in my Telegram group. how to assess patient condition on the basis of trends on LDS, D-dimer, IL-6, PCT, and fibrinogen level. Trends in COVID patient. I think there's a clear-cut PDF that is circulating also. It's taken from AIMS, which tells you clearly that what are the best correlation right now. The CRP is the best correlator to the patient's worsening condition. Okay. And please don't try to repeatedly ask a patient to get a CT scan. Now, as you have just read today, CT scan is worth 100 of X-rays. So don't overexpose a patient to something which it actually doesn't need. Okay. Is there any chance that incentives will be given as a different quotas, further hindering chance of general category or some grace marks? Look, right now, Gaurav, nothing has been said on that. So I will not be a person who should actually tell you that. But yes, if at all that comes up, I'll again put a video forward and tell you that this is actually going on forward. Okay, this may happen. What are your ways to tackle this situation in a smart set? Okay, so guys, there you go. The video I actually made is completely my own views. Your views may differ from mine, but I'll just again conclude what I want to tell you. If you are doubly vaccinated, if people in your home don't have any comorbidities, or you stay alone, you want to serve the humanity right now, join the COVID duty. If you are thinking a lot about your preparation, or maybe you're not well prepared, you want to prepare more, you have some people in your home, you feel that you can infect them, don't join the duty. Do not join the duty. Okay. If you're not joining this duty and continue in your preparation, make sure that you start preparing from those topics in which you are weak. Let's assume that in medicine, you are very, very weak in hyperparathyroidism. Read that topic from a textbook and let that topic become the best topic you're ever actually prepared of. Okay? If you have a gap of more than 2 months and you've taken Covishield, you are well to go. That's best thing to do. I'm a second time dropper preparing from home. I have been studying for more than 2 years. I'm confused whether to join this duty or not. Varsha, if I am in your place, I would have joined it. Will working in a private hospital make us eligible for benefits from the government exams? Nothing has been said on that, but I think any work should be mostly concentrated on the government setup, not in the private setup. Okay. Doing COVID duty and I'm not vaccinated, I am taking vaccine now. Chance of infection will increase during exposure? No. Not at all. Not at all. Sir, if a person is positive after first dose, should that person get second dose after 14 days of negative report, or should he start fresh vaccination? Beta, if he has got first dose, he has got infected, then after negativity, wait for 14 days and get the second dose. That's it. Okay. So I think I have tried to answer most of the doubts. If you have any other doubt, please, or any other thoughts that you have, please, let's not talk about doubts, but if you have any other thoughts that you have, please put it forward and maybe I can answer it in a better way. Since I've taken only first dose recently, can I do telemedicine for 1 month and then I join COVID duty as the government has directed? Yes, I think, Ravi, that is one way also to go forward, but that should be clearly written in the PMO office letter. Any more information that actually comes, I will be sharing you as soon as possible. Okay, sir, I'm an average student having already taken 3 drops. Should I don't do duty or continue my preparation now? Nitin, see, I have a simple statement to you. If I would have been in your shoes, okay, then I would have thought that how well is my preparation already done. Please don't join the duty at the cost of your preparation. What I'm trying to say here is the exam was supposed to happen in the month of January. It actually went to the month of April, and now it has gone to the month of I don't know when. So if you were prepared till the month of January, you got 4 more months and you have not prepared then again, I don't think 2 or 3 months will make a lot of difference now. But at least what you can do now is serve. Good evening, sir. Will there be any official notice regarding when and where will the contact? Yes, definitely, Shreya. Unless it doesn't happen, how will you actually go and whom to contact? There will definitely be an official notice. Your hospital may contact you or may your details are with them, right? So your hospital may contact you that they're now offering this post and whether you want to join them or not. That is how things should work now. Okay, so if that happens and if you're willing to work, please tell them yes you want to, and they'll share with you a small form which you should fill up and send them back. If government provides us food and place to live, most of the Neet PG aspirants won't have any problem because we worry about own family. I completely agree, Kuldeep, that this is the biggest thing that we are actually worried about. Not only about us, but also our family members and about people who can we infect. So unless we are not safe ourselves, unless we can't ensure our family members' safety, please don't join it. Please don't join it. Please be safe and let your family members be safe first. Okay, so thank you guys. I think that has more or less solved most of your doubts. If you haven't watched this video from the beginning, please watch the video from the beginning and it will give you a complete insight as to what the perspective is and what can you do from your point of view. Okay, for any comments, for any thoughts, please put in the comment box. Maybe I can again come forward and let you know what is the best thing to do forward. I hope this video was a bit eye-opener to most of you. Maybe we can motivate ourselves more and more. And anything that you want, please come forward and let me know. I can make one more video and we can discuss this again and again because you have a plenty of time. And yes, after 7 p.m. I do have plenty of time nowadays. Okay? Thank you. Wishing you all the best. Stay motivated, stay happy, and more importantly, stay healthy and stay safe. Stay safe. Okay, thank you guys. God bless you all. Keep smiling and be happy. Bye bye.